अस्सलाम वालेकुम। गेस्टाल्ट साइकोलॉजी या थेरेपी में हमारी सेकंड वीडियो है। चलिए स्टार्ट करते हैं। आई टेक द रिस्पॉन्सिबिलिटी टेक्निक। A central goal of the Gestalt therapy is to help patients understand, accept their needs, desires, and fears. A basic assumption is that all of us do not perceive situation as they are. We engage our social environment by projecting our needs, fears, or desires. So we have to take the responsibility of our engagements. The patient have to bear responsibility for his present and future lives. The therapist instructs him to change his thinking from they, them to I. It means the patient must take the responsibility of his or her behavior. Number 3. Recognizing interruptions and avoidances. We try to avoid painful or unpleasant memories through different ways. We interrupt our awareness or resist our feelings by holding the breath or tensing the muscles of the body. By tracing or observing closely the client's behavior, the therapist is able to spot points of interruptions of flow in the ongoing process. Shifting the topic of discussion, changes in eye contact, movement in body position, a sentence left unfinished are the major cause or cues for the therapist to track interruptions or avoidances. According to them, non-verbal behavior is important. The skilled Gestalt therapist focuses on two aspects of interruption or avoidance. First, noticing what is interrupted or avoided. For example, is the client not recognizing his or her need, or is this stopping from mobilizing his energy? Is he not making contact with what will meet his or her need, or is he unable to let go? Secondly, the therapist identifies the contact styles that have become habitual for the individual and now they might be explored. For example, does he not reflect his sadness or does he express it? Does he project his feelings on others? Becoming aware of interrupted gestalts and avoidance of engagements with others is the first step in self-caring. Working with transference. Gestalt therapists opposed strongly transferical transferential relationship, mean that clients' reactions are free of transference. But the therapist is challenging the transference and inviting the clients to use their eyes and ears to see and hear the actual person behind then projections. Empty chair technique. In the empty chair technique, a client projects and then talks to the projection of a feeling or to a person, object, or situation. Usually, client speaks to someone with whom he has unfinished business. For example, if a patient is crying, the Gestalt therapist might ask the patient to adopt opposite to crying behavior and talk to the tears. This tactic often seems to help people to confront their feelings. Two-chair technique. Two-chair technique has been widely used by the Gestalt therapists as a means of exploring communication between different selves or between self and other. Physical shift as moving from seat to seat, how a life scene is seen from one position or from another. Gestalt therapists avoid to make emotional relation.